Hi, I'm an occupational therapist and this is my story. I'm an occupational therapist working in a stroke team. I identify as female and my pronouns are she, her. I live with chronic pain caused by endometriosis and polycystic ovarian syndrome, also known as PCOS. I've lived with these conditions for 10 years, but obtaining a diagnosis took 8 years. I experience pain in my abdomen and lower back. The pain impacts almost every area of my life. I experience insomnia, fainting episodes, and vomiting. During flare-ups, I take strong painkillers, which means I'm unable to drive. When I'm ovulating and on my period, I'm essentially bedbound due to pain. My condition causes many challenges in my work. I become tired very easily, and when I'm experiencing a flare-up, I find moving and handling difficult. I often feel guilt when I need to take sick leave, knowing that it negatively impacts my colleagues and patients. Before I had a diagnosis, things were even more challenging. I'd been told by many health professionals that there was nothing wrong with me, and this caused me to feel a lot of shame and resulted in me hiding how bad my symptoms really were. I would often force myself to go into work when I didn't feel well enough. There was an occasion where I fainted at work, and when I was coming back into consciousness, I heard 2 colleagues saying that I was faking it for attention. Unfortunately, I didn't receive much support from my manager either, being told that I shouldn't be working if I was experiencing so much pain, with no option for reasonable adjustments. If I could remind my employers and colleagues of one thing, it would be to be kind. Remember that a lot of disabilities are hidden, and just because somebody doesn't have a formal diagnosis doesn't mean they aren't struggling and experiencing symptoms.